The wave of COVID-19 in Shanghai showed a rapid increase in its curve. We have facing the most challenging COVID-19 situation, and we have seen a rising number in confirmed cases. The situation in Pudong and other areas have seen a quite wide range of transmissibility. Without strict measures, then there will be a huge potential risk of larger scale infection. That is why we're also under a very huge pressure in order to curb the spread of the virus. Under the guidance given by the National Health Committee group, taking Huangpu River as a middle part, we divide Shanghai into two parts, and we use the fastest speed to check the potential transmissibility with the lowest cost we could achieve. In the previous round of NAT, since 28th of March, Pudong and Punan have conducted its new round of NAT. So far, we have seen a smooth order of testing. What touched us most is the supporting and cooperative received by the residents in Shanghai. We know the COVID-19 containment have caused some inconvenience to people's way of life, way of work. We know that there are a lot of difficulties for everyone staying at home. And we're also touched by the personnel working on the front line, including our medics, our volunteers at the community levels, the transport people. In the past 1 month, we worked days and nights to stick on our posts. We made arduous efforts, and we also, with gratitude, to receive the support and assistance from the neighboring provinces. Your help is highly appreciated. On behalf of the government of Shanghai, I would like to extend our heartfelt thanks to all the residents in Shanghai, and also for all the friends who have given us support, understanding, and help. A big thank you to you all. Omicron is dominant variant with high contagious. We not have enough preparation in face of this transmissible and contagious variant, and there are also some measures not practiced fully, and we admit our mistakes, and also we do our utmost efforts to improve our weakness. Followed the guidance given by General Secretary Xi Jinping and also the working plan of the CPC Central Committee and State Council, the leader of Shanghai taking charge of the COVID-19 containment work. The loophole we found in previous NAT help us to improve the mechanism, and also set up the necessity guarantee place, and also other 5 working groups. We have people with clear role and responsibility as contact person to improve our loopholes. And regarding NAT, we make sure that there's no long queue waiting there to avoid the cross-infection happened during the testing, and also make sure everyone who need to be tested. And also we will do everything we can to accelerate the transportation time by transferring the confirmed patient to the designated place. Regarding testing, hospital beds, new pharmaceutical support, and also the new testing kits are all under preparation. The western bound of Pudong right now facing the end of this round of testing. Based on the result of this round of testing, plus the suggestion given by the National Expert Group of the Health Committee, we will conduct a dynamic control of COVID-19. And tomorrow, the eastern part of the Pudong River will conduct their round of testing, covering 12 districts with 1.6 million people. Well, that's even a larger scope of testing. And we will continue our hard work, and also would like to thanks in advance for everyone's support and understanding. And we talk about the closed-off management is also well taking place. And also, if you're waiting for your testing, and please wear a mask and keep social distancing. And we will also intensify our efforts to meet people's need in daily necessity. And we'll also work with neighboring provinces to allocate more supplies to Shanghai, make sure that we will break all the obstacles in our way, and we will meet people's need to buy vegetables and other daily necessities. For residents, especially in the closed-off management compound, we will listen to their needs, especially the in-hospital service, and we will do everything we can to solve the people's need to visit the hospital. Right now, 12345 hotline and also the other official accounts also available for the residents. If you have any difficulties, please contact us in different multiple channels, and we will do our utmost efforts to fulfill and meet your needs. And for all the measures in place, we'll make sure that we'll implement them in letters. And for SMEs, we will also help them to overcome the most difficult time. We should hold each other's hand to tide over this difficult time, especially in face of COVID-19. We will work together with everyone to save Shanghai. Right now, we're in a critical time. We really want people's support and assistance, and also the whole team at the front line for the arduous efforts, and also the party members' contribution. With 25 million residents in Shanghai as our fortitude, we will have every reason to believe that for sure that overcome this hard time and will beat this virus, and we will back to normal life very soon. Thank you. Thank you, Mr. Ma. I'll give the floor to Mr. Wu. Friends from the media, good morning. I would like to give you the updated information regarding COVID-19 containment measures. As March 30th, 355 new cases reported and 5,298 asymptomatic cases reported. 10 confirmed cases found in quarantine place, and the other 300 cases found at the close-off management. 404,077 asymptomatic cases found at the centralized places, and 821 cases found at the closed-off management place. So for the 355 confirmed cases, 183 male, 172 female. Pudong New Area, 249 cases. Minhang, 19 cases. Huangpu, 16 cases. Xuhui, 15 cases. Jiading, 9 cases. Changning, 8 cases. Jing'an, 8 cases. Songjiang, 8 cases. Fengxian, 7 cases. And Putuo, 6 cases. Qingpu, 5 cases. Yangpu, 3 cases. And Hongkou, 1 cases. And Hongkou, 1 case. So in total, 355 confirmed patients with COVID positive. So based on their clinical results and the imaging results, right now are confirmed as COVID-19 patients with mild symptoms. For 5,298 asymptomatic cases, you can find their detailed epidemiological investigation online through our official account. As of 9 a.m. today, so far we have around 36,000 people as close contacts. 30,719 showed COVID negative. The others were still waiting for their testing results. And the 70,000 people general as the general contacts. And around 66,000 people showed negative to COVID, and the rest still waiting for their COVID-19 testing results. We talk about this round of testing still underway, as introduced by Mr. Ma. So this covered each household at the western bound of Pudong at Huangpu River. Therefore, we need to really detail-driven our COVID-19 measures and also make sure that we will have enough supplies and guarantees in place. And all the testing should be finished in time, and by studying the result of this round of testing will lay a solid foundation for us to roll out the second round. And we sincerely hope that each and every resident of Shanghai be cooperative while practicing COVID-19 containment measures, and we work as one team to beat this virus. Thank you. Thank you, Mr. Wu. Now the floor is open. Please identify your media affiliation before raising questions. CMG CCTV, my question regarding the people that in their first round and in close-off management place, they have a complaint regarding the really limited access to hospital service and also the slow transporting people to designated hospital, and also regarding the people's medical needs, especially for elderly people. Yes, indeed, we have heard the people's complaints, especially their complaints regarding the hospital service, access to hospital service. At the different hospital agency, right now, all open to the public while practicing COVID-19 containment measures. Based on the situation we found in the western bound of Huangpu River, we have allocated equipment and personnel to support the people who need the hospital service. For example, for people with the hemodialysis, we will provide service to them, and also we talk about for people asking for the prescription. If they have the confirmed symptoms, and we talk about people like the high blood pressure, and this kind of the chronic diseases, then if they're entitled, then they can get a prescription as long as for 3 months. And also on the community level, the community hospitals, the household doctors can be more proactive and listen to their patients' needs. And also regarding the other service for the chronic disease patients, and also for the other hospital service needed people, I also suggest you to visit the online hospital service platform, and we also have hotlines available. So the urgent needed hospital service could be provided to people. We also do our utmost efforts to provide a day-to-day hospital service. We know there's much room to improve in this regard. A 120 call center, right now they work under huge pressure, and we also improve their capability. Right now we have added 50% more ambulance, and right now their workload actually is tripled than the previous time. We know that all these, although that the capability increased, but still could not meet all needs. And also the situation shows that the people a lack of experience, and they not have enough skill set. So for the whole health community system, we should reflect the situation and to improve our weakness in order to have a stronger medical system and the capabilities. So we will do everything we can to protect people's safety and security. Shanghai TV. A question to Mr. Liu, and the second round will be started tomorrow, and also a close-off management will also practice tomorrow at the eastern side of Huangpu River. So how we can guarantee a smooth transport system? So from the tomorrow to the 5th of April, there will be the second round of testing. The buses, public buses, the cruise, the ferry, the hot taxis and taxis will have the following changes. For the rail service, all the rail station will be closed off at the eastern side. The western side and the south side of Huangpu River, part of the stations and lines will continue to be shut down temporarily, and we will release the details in a timely manner. For the other lines and stations of the rail service, will back to service. Regarding the public buses, all the buses lines will be stopped except the lines to the airports in the eastern region. For the lines, their destination will be in the eastern region. That will be shortened their lines. And for line 2, line 4, line 5, line 9 to airport will be also changed. Line 7 from Pudong Airport we shortened to Longyanghu Station. And 4 lines operate normally. That will be the Circle 1, line 8, line 1, and also the night lines. Line 1 and the night line will not stop at the close-off areas. From Hongqiao Airport to Pudong Airport, for the passengers, if you need to take this line, you need to use your tickets, either the flight tickets or the train ticket. On top of that, also need to show your 48 hours COVID-19 testing results. The taxis or the held taxis should not operate in the closed-off areas. And the taxis with license, they can park at the Shanghai station, Shanghai Hongqiao station, T1, T2 terminal parking place to operate the services within a closed-off management place. For other taxis or held taxis without license, they cannot provide service within the closed-off regions. For the chartered cars and other car service will be suspended in the closed-off area. The Jingshan train line also stopped. Shanghai West, Nanxiang North, Anting North, Anqing East, Songjiang, and Songjiang South Station, Jingshan North Station, and without passengers getting on and off. Huangpu ferry service, Shandao service all stopped. For the transport arrangement will also be changed dynamically in cope with the COVID-19 situation. We will keep you posted. Air service, train service in Shanghai still in service. In order to make sure that the service still provided to the passengers leaving or arrived in Shanghai, a special line available to airport. So it's covering Hongqiao transportation bus and the rail Shanghai South and North station, and also the Weifang bus service station. That will be a two-direction service. Still, the passengers with the train or air ticket on that day, and also the COVID-19 negative testing results within the 48 hours validation. And the Dongfang and Weifang station will be the place for the passenger to get off. For the other stations, will not allow the passenger to get off. From Dongfang to Hongqiao, will be let the passengers get off, get on at Dongfang Weitiao, and for the other stations, only allow the passengers to get off. In terms of the traffic, we also provide a number of the 100 buses, 100 coaches, 200 taxis for a backup plan. So we'll bring the passengers to Shanghai North Station, and then the taxi will bring that point-to-point transportation service. Once again, under the closed-off management, where people within this management region make sure if not necessary, please do not go out. Thank you for your cooperation and understanding. Wenhui Daily. And the eastern side of Huangpu River will practice closed-off management, so any suggestion to them, and also suggestions to testing. And for antigen testing, shows negative, so the obvious sign, or that's the obvious sign from their mixed testing, so what they should do. So regarding that, what people can do after close off, we talk about protect yourself and then to conduct less gathering. And the less mobility is very important. We talk about it's necessary. Do not go out. Do not go to the gathering place. So slow down your way of life. We talk about the one time. The slow down will help us to move faster. In the later time, we talk about less traffic, less gathering. Shows no chance to the virus for transmissibility. And regarding the protecting work, so if we stay at home, normally we talk about to protect yourself well, that when you're going out. But if you stay at home, you also need to protect yourself well. That you need to wash your hands frequently, and also you need to conduct ventilation also frequently. And also, if possible, and one person per room is suggested. And also use shared chopsticks and spoons for meal. And regarding people that have to go out, and including people visiting a hospital, we talk about production. Is that first, wear masks. Second, keep social distancing. Third, you're taking public transportation service or go to a high density population place, and you could practice a staggered manner. And still, we not encourage people to go out, but if you have to, please scan the code and also show your house code. And also please be cooperative with your destination. So, conduct less mobility, and second, protect yourself well, indoor and outdoor. And regarding your second question, as what we need to do during testing period, and we have seen that in our circle of friends, that says people seeing that our neighbors and really like to see you, especially in a lockdown lifestyle. I would like to have a little bit chat when we're waiting for our testing turn. So we talk about for each community, you need to have a the considered plan. So talk about that for different buildings, how many residents, how many households are there, and what's the time arrangement for different buildings, for different household. And also they ask a household to come to test at the assigned time. And for each household, you should go out when you received your call. So we can make sure there's no long queue waiting there for testing. And when you're waiting in the line, and keep social distancing. And maybe no talking face to face. Wear masks throughout the whole period. The only time that you are allowed to mask off is the time when you open your mouth for testing. That is the only time you can get your mask off. And the third question to ask that for the testing results, we talk about first is self-testing, that's the antigen testing, and second is a mixed testing, and third is one person per tube, that's a single tube testing. We talk about self-testing. We know that a 50 minutes or 30 minutes waiting time is really a panic time. So when you see that two red bars showed on your testing results, what you need to do. First, when you see that two red bar means positive, and you need to first protect yourself while protecting quarantine. So we talk about self-testing, basically these kind of tests conducted at home. So the first thing is wear masks, and also let your family member also wear masks, and keep distancing from your family members. If necessary, if possible, then you stay in a separate room. And second, make a phone call immediately. So you need to tell them that you showed positive at the self-antigen testing. And second, you also need to report that maybe you not operate correctly, so you could ask whether you can get another self-testing toolbox. And also you need to state clearly your home address, because we will assign a medical staff to your doorstep to double check. So you need to provide a very clear, accurate home address. And third, show the results. You cannot throw them to the normal garbage bins. You need to collect them in a separate bag. And when the medical staff come to your doorstep for double checking testing, and you also need to give that your whole bag of the testing kits to the medical staff. We talk about these considered as the medical waste, so that will be disposed in a separate manner. And regarding the mixed testing, that's normally at the community shows positive, we talk about as the one tube with 20 samples. So if showed a abnormal sign, then these 20 people should be tested one more time. Then first, stay where you are, and then you tell the people who made this phone call to you to provide a clear and accurate address of your position, and also protect yourself well, putting on your mask, keep social distancing while waiting the medical staff to get you another round of tests. And third, regarding the single tube testing. So when you receive a phone call saying that your testing results is positive, we know this kind of phone call is really make you panic, scared, sad. So these are the things you need to do. First, don't panic. keep yourself quiet, and then protect yourself, put on your mask, keep social distancing, and also ask the people staying under the same roof with you to also wear masks. Open the windows for ventilation, and also make yourself in a separate room. And also make sure that you have your phone available so people can contact you when they come to your doorstep for testing. And third, also need to try your best to think about your travel history in the past 3 to 4 days. Where did you go? And who did you communicate with? Then that will be a group of people with potential risks. So you can start to write down your travel history in the past 3 to 4 days. So this is very conducive for the people to screen out the close contacts and the general contacts for the epidemiological investigation. And fourth, when you know that you're positive to COVID, also need to inform your relatives, your family members, your friends, especially those who met you in the previous days. No matter it's your friends or family members, you need to inform them that you are also under high risk of COVID positive because I'm positive. So ask them to stay still, waiting for the medical staff for further investigation and also waiting for the further phone calls. And then the last step is to prepare yourself well to the designated hospital or the centralized quarantine place. So you need to prepare your personal belongings, so your ID cards, and then the medicines, or daily medicines. So for your day-to-day medicines, please also prepare those. And third, your clothes. And fourth, daily necessities. And fifth, phones and also your chargers. Make sure that people can contact you around the clock. So normally these are the 8 steps you could follow when you show positive to COVID. When everything you are ready, very well prepared, then you could waiting for the medical staff or volunteers to bring you to the quarantine place or hospital for further treatment. One last question, please. Thank you. Paper. Question to Mr. Wu. For the centralized treatment place, the treatment approach to these people in the makeshift hospital or in the designated hospitals, they are the identical approach. No matter in the designated hospital or in the makeshift central quarantine sites, for COVID-19 possible patients, follow the treatment protocol. We want to achieve one goal, and we bring all these group of patients to a centralized place for quarantine purpose. So it will be under observation and given needed treatment. We talk about the hospitals, and other is the makeshift quarantine sites. So based on the classified standards, the patients will be put to different facilities. For the designated hospitals, so the priority given to the patients with moderate, severe situation. And some of the mild symptom or asymptomatic patients will also be hospitalized. First, the underlying women, they cannot put in a quarantine site. And also elderly people, especially above age 70, and the young children or babies. So they need a supporting assistance, especially elderly people. Majority of them are with underlying diseases or chronic diseases. So they will be put in the hospital. For centralized makeshift sites, so the patients with mild symptoms or asymptomatic patients will be put into this facility. So judging from their age, will be young people, and no severe underlying or chronic diseases. For these two facilities, we talk about that's one key purpose to quarantine patients and also put them under close monitoring to see whether their symptoms are developing or not. We talk about asymptomatic patients could develop to confirmed patients. And also for the patients in the makeshift quarantine place, if we found that they had the underlying disease, they will also transfer to the designated hospital. So at the makeshift central quarantine sites or the designated hospital, TCM, the traditional Chinese medicine, is widely applied. So that will help to improve people's immune system. For makeshift sites, we put a very close eye on the development of their symptoms, and also we will run before the curve to bring the people to designated hospital if their symptoms worsen. Their symptoms are worsening. But all in all, the principles are identical in the different facilities. So no matter it's hospital or quarantine place, all patients, if they meet the standard of the freeing from hospital, are identical. So we should follow exactly the standard of the standards set in the protocol to see whether this person is allowed to be freed from hospital, and also that just that the people with different symptoms or with different severity of COVID-19 and put into different facility, but all the general principles are the same. That's for today's presser. If you have further questions, please contact the health committee, and we will also keep you updated. That's all for today. Thank you.